So we'll look at the next structural congenital issue. Now this is what is known as microcephaly. Okay, so breaking down this word, you look at micro means something that is small. Cephaly means your head, so it means your head is smaller than it should be. Okay, so this is a normal hair size, so you have microcephaly where your head is smaller than the normal. That it could be so severe. Okay, of course, if your head is smaller than the normal, your brain tissue too is smaller than the normal. So this will affect the functions of that brain tissue part. So microcephaly, we said, is a neurological condition. This is where the baby's head is significantly very small, okay, than what is expected. So the baby's head is smaller than what is expected. Okay, so this usually reflects abnormal brain development. Of course, if your head is smaller than the normal, your brain too will be small. All right, so this usually reflects what abnormal brain development, either during pregnancy or maybe shortly after birth. So microcephaly can be congenital. They give birth to you with it, okay, or sometimes it develops after birth. All right, so common causes, like what will make a head of a baby not want to develop properly. So things like Down syndrome, Seckel syndrome, infections during pregnancy, Zika virus, rubella, cytomegalovirus, toxoplasmosis, exposure to toxins like alcohol, drugs, lead, mercury, severe malnutrition during pregnancy, birth complications like there was lack of oxygen supply, then Craniosynostosis. All right, like this, the bones of the skull, they are supposed to still be flexible and allow for the brain to develop further before they fuse. Do you understand? But if the fusion is so early, okay, the skull is now rigid, it will not allow the brain to develop further. Do you understand? So for a baby that have this, what you observe is what the head is very small. Of course, just by looking at it, you should be able to know. Developmental delays, of course, some parts of the brain is not there to facilitate some things like speech, motor skills, learning. You understand? So you have what these things will develop very slow. Seizures like what? Okay, seizures, then facial abnormalities, balance and coordination issues, intellectual disability. So diagnosis is prenatal ultrasound. So head circumference measurement after birth, MRI or CT scans to assess the brain function, genetic testing, and blood work to identify underlying causes. Right. So treatment and management is this. There's no cure, but just treat all those symptoms. So if they're having problems with speech, you try to do speech therapy, okay, physical therapy. They're having seizures, you give medications for that. Educational support, because this group of people, they learn very slowly. Okay, regular monitoring by pediatric neurologists.